All right, Mark, thank you. A lot of people that have had laser vision correction, including myself, say it's one of the best things they ever did. But one of the problems is, how long will it last? It hasn't been around that long. So this morning, we're talking to Dr. Charles Flowers a little bit about laser correction, or eye correction. And this has been around since 1995, is what I hear.
Correct.
Okay, so because it's been around just a few years, how do we know, what do we know rather about how long the effects of the correction will last?
Well, actually, going back, the initial studies, the clinical trials started in 1988. And so it came out of clinical trials in 1995. Okay. So in fact, it was approved for general public use in 1995, but we actually had been doing studies since '88. And so right now, what most recently in the October issue of the American Academy of Ophthalmology Journal, they published a 12-year study where they followed patients who were in the original clinical trials out for 12 years and found that their results were stable for that entire period of time, which is quite, which confirms what we generally believe. We generally believe that after 1 year, what you have in 1 year, you're going to have for the rest of your life.
Oh, wow, okay.
Yeah.
So then what about just the, excuse me, just the aging process in general? I mean, sometimes folks that are in their late 30s, early 40s, with good vision start to experience maybe a little fuzzier vision. Will that happen to folks that have done the laser eye correction? Does the aging process at some point take over?
Well, the aging process doesn't after the 1 year, because we believe that generally it takes about 6 months to a year for your eye to completely heal after the initial original procedure. After that 1 year period, the effects of LASIK we generally believe will last for a lifetime. Now, as you get older, there are things that can happen inside the eye. You can develop cataracts, you might develop glaucoma, macular degeneration. All those things can occur, which can change your vision, but they should not affect the overall effects of the LASIK per se, because we're actually doing the surgery on a different structure per se.
Oh, I see.
Yeah.
So as that happens, then you're saying that whatever effects the aging process takes on you can be corrected in a different way?
Exactly,
okay.
Exactly. And won't affect the necessarily affect the results of the LASIK. So if you develop a cataract, certainly you would need to have cataract surgery to remove that, but your overall effects of the LASIK would not be changed.
What about any complications? Would you know right away if you were going to suffer from any complications, or does it sometimes take a while to figure that out?
Well, the studies generally, again, within that first few months or so, that's where we start looking for things. But generally what the studies show that for 12 years, none of those patients had late-stage complications. Again, that's a really big question, is something going to happen to me bad 12, 20 years from now? We don't believe it to be the case, and this study certainly does support that contention.
Okay, so overall, just as an expert in the field, for folks that might be thinking about it, maybe a little bit afraid of it, is it recommended by experts in your field?
Oh, absolutely, absolutely. I think right now one of the most encouraging things about that study was the fact that that study showed long-term stability using techniques and lasers that are no longer, and since everything's been advanced and improved since that time, so the techniques that we use are much better, the lasers are much better, we're getting greater precision, it's hand safety and better visual outcomes. So we believe that those results are great because they were used on the earlier technology. Now we've got better technology, and we believe that we're going to actually be able to achieve better outcomes for a long period of time for people.
All right, and I assume that as the technology grows and as this becomes more popular, the cost of it will probably decrease as well for folks, for more people to be able to take advantage of it.
Well, it's really affordable now. I mean, there's a lot of financing programs. Obviously, the cost of the technology is what drives up the cost, but there's been a lot of ways to make it affordable through financing programs and things like that.
All right. Well,
yeah.
Dr. Charles Flowers, thank you so much for coming in this morning.
You're
Appreciate
welcome.
it.
All right.
All right.